Our top story at 4:30, the state of COVID-19 here in Colorado, with right now nearly 1,400 people hospitalized with COVID. We show you this graph often to show you the number and how it compares to our all-time peak, nearly 1,900 patients. That's early December of 2020. Now we want to take a look at what's happened to the pandemic just over the last 6 months. You can see hospitalizations dropped off over the summer after vaccines became widely available. At its lowest, we had only about 200 people in the hospital with COVID, but then came the Delta variant, hospitalizations picking up again before hitting that brief plateau in early October. But then you can see, looking to the right, hospitalizations are rising once again. So here to put some of these numbers in context, help us understand them further, our 9 Health expert, Dr. Payal Kohli. So how bad is it right now in Colorado to understand that with vaccinations going up, those numbers that we just saw in the graph are going up too?
You know, Tom, it's alarming because we're almost at the numbers that we were at last year when we didn't have the vaccines. We have 1 out of 3 ICUs anticipating bed shortages this week. We have a positivity that was 11.6%. So I really feel like we as Coloradans have to take responsibility, change something, because we played our trump card. That was the vaccine, and the virus still looks like it's winning.
Is the impossible question how and why this is happening? Do we know?
Why us? I mean, very, very complicated. We're high rate of vaccination, but still the 5th worst state. And I think the problem is we're a hotspot. And it's a hotspot creating more and more infections. So until we change something, which is our behavior at this point, and get that last 20% vaccinated, get the rest of us boosted, I'm afraid heading into the next few months with travel and everything, international travel now opening up, we're headed for something really, really concerning.
I was going to ask about that because many of us have family that came to Colorado this summer just because now that we can travel, we want to come to Colorado. But now everybody's thinking about Thanksgiving and Christmas. I mean, a year ago, we were making some really tough choices. What should we be doing now?
I think we need to shift back into that mode with how much infection we have in our community. Because like I said, there's 2 factors in us getting sick. One is whether we're vaccinated, and the other is how much infection. And here in Colorado, we've done a good job with most of us getting vaccinated, and yet there's a lot of infection. So at this point, I would say, if you're not vaccinated, Thanksgiving only a couple of weeks away, probably best to cancel plans, because the statistical probability that a gathering is going to have somebody with the infection, maybe even they don't realize it, is pretty high.
That's tough socially, that's tough politically, and maybe hard to push against those 2 things. So last night we saw all those people watching Nikola Jokic get into his brawl over there with Markieff Morris, so that there are thousands of people going to games. Is that okay at this point, or is that something you'd be doing?
You know, I've just been dialing back. I'll be honest, I haven't gone to a sporting event, a concert. I was going to restaurants and seeing my friends. I'm starting to cut that back. I have been traveling, but even that is now starting to give me pause because I'm taking the virus to other people because we're the hot spot. So we're the ones that are going to be spreading it to others. So I would say the virus has been moving, it's been winning. We have to do something. We have to reciprocate, change our behavior.
So look ahead for us. Give us some projections on what's going to happen now with the vaccinated and the unvaccinated as we look down the road.
So if infection continues like this, Kim, I'm afraid the cases in the unvaccinated are going to explode. We're already seeing our hospital being flooded with that. But even the cases in the vaccinated are going to continue to increase. And we have a mu variant now, which data just came out of the New England Journal of Medicine that the Pfizer vaccine and natural infection doesn't protect against. And thankfully, it hasn't spread quite like Delta has, but it's just a matter of time.
Wow. Well, there certainly is a lot to consider with the holidays closing in and those numbers that are continuing to get our attention. But we appreciate you coming in and helping try to add some context to it as always. Thanks, Dr. Payal Kohli.